and we're talking about exactly what happens to a patient with ADHD and how to treat ADHD, and that'll be a different video. But what exactly are the symptoms of a patient with ADHD, and what does ADHD do to the individual's life? We have a patient here, ADHD. She's agreed to come on, but we're not going to be revealing her identity, but just her voice, as she's that's what she's revealed. Go ahead. Can you hear me?
Yeah. Hey, doctor.
Hey, how are you?
I'm good. I'm okay, doctor.
Okay, fair enough. Thank you for coming on the show. So can you tell me um, what brings you into the clinic, and what are the issues that you've been having?
Yes. So, uh, I don't know, doctor. Sometimes it's hard to explain, but I'm really hoping you can help me. I jump from job to job, interest to interest. I cannot manage myself, my time well. Relationship starts off with lots of excitement and then it fades, and then I jump on to the next relationship. I struggle with everything on the daily basis. I have so
Mm,
much excitement for something in the beginning, but then it dies down. I cannot I cannot make a normal conversation, a face-to-face conversation for someone with someone for more than 15 seconds. It's just it's just so overwhelming. I feel sad, I feel guilty. I feel it's just so repetitive. I repeat my mistakes over and over and over again. I really need your help.
mm. I can see. I hear you. Let's go back to the first thing you said, um, where you said that basically you're having trouble with jumping from job to job. I think that that's the first thing that you said. From what I remember, I think the second thing you said was you have interest to interest, and then third thing was relationships with the three things, part of the three things that I heard in the beginning, and then we can get on to the other things that we've heard thereafter. But let's just talk about job to job. What do you do? What's your work?
I work as a receptionist currently.
Okay. Okay. So you work as a receptionist. We're not going to ask you where, but do you not like working as a receptionist? Is that why you move from job to job, or what's going on?
Actually, I had interests, so many interests. I love talking to people,
Mm-hmm.
but then at the same time I feel overwhelmed by it. I start a job, I with the feeling that I'll be able to do it. I'll do a good job at it, and of course it'll pay off my bills. But then it's just hard, doctor. It's just so hard that day to day, just going through it. It's just so difficult.
What's difficult about the job? You're a receptionist,
For
so I imagine.
currently, yeah,
Go ahead.
some days I am excited to talk. Some days I'm excited to talk to people and, greet them with a smile and talk to them. But some days I just feel I just don't want to talk to them.
Mm.
Although I just lose interest. I'm supposed to be always, be ready for whoever is coming in and giving them, I mean, information, what they want, what they're looking for. But it's sometimes some days it's okay, but some days it's just I just can't do it,
Okay. And what's
and then I
the?
lose, and I
Go ahead.
and then I lose interest, and then I look for something else that maybe this is not something I want to do. Maybe
Okay.
this is not something I can do.
All right. Absolutely. So let's go back to the beginning of life. Like when you were in grade school, how did you do? How did you do in grade school?
Um, I was okay. Like I said, I had some friends, but I never had really close friends. And I just sometimes I would feel that I'm just not able to do a very simple task.
Hmm.
I have great ideas. Like
Hmm.
sometimes I have excellent ideas, which I think and even others think. I just cannot execute them. I
Hmm.
just cannot put them into action. And why is that? I know those ideas can make me successful, can bring me really, ahead, but I just can't execute on them, those wonderful ideas. I
Right.
want to improve my life,
Hmm.
but I make to-do list. I make so many uh, resolutions, but I never get around doing any of them. It's just hard for me to pick up.
Hmm. Let me ask you, how many
I
jobs have
was
you had?
I was the class clown at
Hmm.
school.
Hmm.
Can I
Oh,
tell
really?
you, I was the class clown at school. I was
Oh, you did.
restless constantly.
Hmm. You're the class clown. But tell me about jobs. Let's go back to the jobs. I know you want to talk about, all the rest of this stuff, but let's leave this one directly to jobs and all these. Sounds like there's definitely a component of possible ADHD here, and we're talking about ADHD, and we've talked a little bit before this about what's going on. But how many jobs have you held?
Mm, honestly, I now don't even remember. I'm sure more than 15, 16. I don't,
I don't.
I think
Oh,
more
I'm
than
sorry, I
that.
can't hear you. You went out a little bit. Go ahead.
Can you hear me?
Yeah, yeah, yeah.
Can
I
you
can
hear
hear you.
me?
Yeah, yeah, I can hear you. Go ahead.
Honestly, I don't remember now because I've changed so many of them. Sometimes I would just go on my job and I would just leave it the first day. I just go show up, and then by the evening I would feel I don't want to do this. So
Wow. Okay, so you
honestly,
wouldn't even give
lots of
yourself a chance.
I think
What's the shortest? What's the shortest job that you've kept?
the one I just mentioned, one day.
Hmm. Okay, so right now we're going to go into a little bit of cognitive behavioral therapy. I'm no longer going to refer to you as you, but I'm going to refer to you as your body, and I'm going to say how many jobs has your body had, and we're going to go from there. And this is, have you heard of the Vivek Baluja technique?
No.
Hello.
Please, please tell me. No, I haven't.
Okay,
Can you
so this
tell
is a
me?
cognitive behavioral therapy. This is a cognitive behavioral therapy that I
Okay.
actually invented, but I didn't invent it because it's my idea. I'm just putting my name on it because I think I'm the first one to actually introduce this as a cognitive behavioral therapy here. But I think people have alluded to this before all throughout time. Do you know authors like Eckhart Tolle, and do you know, um, are you aware of these people?
Mm, yeah, I see
Okay.
them.
Okay.
I see
So
their
like,
posts
right.
sometimes.
Right. So it's like the power of now and all of this. But for a person with ADHD, it's very difficult to come directly into the now. So there's sort of some mind hacks that you have to use with ADHD, or your body has to use with ADHD. Um, I'll use you and your body differently. So but before I get started, just so I can do an assessment, a full assessment here, have you ever used substances like tobacco or anything like that, or on a regular basis, um,
Um,
or like
yes, I
drugs or
struggled with
hmm,
yes, I struggled with my addiction.
hmm. Okay.
I
All right.
I
So that
smoke cigarettes.
okay. Okay. You do smoke cigarettes currently. How old are you?
I'm 40.
You're 40 years old. Okay. Got it. So what we need to do is we need to talk through this and go, are you married or unmarried?
I'm not married, doctor.
Okay. Relationship,
I,
long-term
yeah,
relate.
but I just broke up. I just broke up.
Okay. Okay. So we have to be careful about, you know, when we're going through breakups and like all these things, you know, emotional turmoil and all this. So the reason that the ADHD brain goes through this on a daily basis is they go through this thing which is sort of a yearning for this chemical called dopamine, is what the science is telling us right now, and it overlaps a lot with my research, which is
Mm-hmm.
sort of addiction and substance abuse and whatnot. And I look directly at all of these things quite a bit. Did you understand the last two sentences that I said? I have a tendency to speak pretty fast, so I just want to make sure.
Yeah.
Okay. So I think one of the things that you need to understand about ADD or ADHD is that it's actually a structural problem in the brain. That's number one. Number two, it's a chemical problem in the brain. Um, but there are hacks to overcome this. So say you didn't have medication, which I'm not saying we're not going to give medication, but we're certainly going to do that. But medication won't help you completely all the way. And your cognitive behavioral therapy has to start now. Because in order for you to get to the point where you're living sort of a happy life and you don't have the comorbidities of depression, the comorbidities of anxiety, and all these other comorbidities, you have to start to learn to look at life in a very, very different way. And in order to look at it in a different way, you really, really need to use this technique. And this is something that I've sort of, after,
Okay.
reading about this for a lifetime and understanding it on a very deep level, what I do is I recommend that my patients use this technique because it's a quick practice to start to help you to do things. So when you were young, did you like to play video games?
Yes, I loved video games. I just now I would love to play, but I just don't have enough time, and I just don't not able to manage my time to play video games. I love video games.
So imagine yourself as a small child, and this is not to be condescending at all, but every ADHD person has, or personality has this thing that I've seen, almost everybody, and this is very helpful. They're very good people to be able to delegate things to other people, if they can write it down and if they can express it
Mm-hmm.
to the extent that they want to, but they're not able to execute it themselves. Unfortunately, not everybody has 10 staff members to delegate things to, and to be able to organize 10 staff is also a thing. So one of the things that you
Mm-hmm.
do is you think of yourself as a player in a video game, and your chief goal
Okay.
is to is to is to control this individual. So when somebody says to you to control this player's senses, let's take an example of something that may or may not have happened earlier on in school. So say in school your teacher yelled at you for some reason. Now, if you were playing a
Mm-hmm.
video game that in where a teacher yelled at that player, that would do nothing for you, that wouldn't do much to you. It wouldn't cause you to get involved in a conversation in your mind constantly. We refer to that as preservation in ADHD. Okay, this is a phenomenon called preservative behavior. Um, Dr. Bruce Shapiro at Johns Hopkins and Kennedy Krieger has written papers on this. A lot of people have written papers on this perseverative behavior. Alec Kuhn, along with some other people, have actually written papers about this and alluded to this in their papers, in their functional MRI papers. And what this is that the brain gets into this sort of cycle of thinking the same thought over and over and over again, and they
Mm-hmm.
fixate on one thing over and over again. And some
Yes,
people call it
yes.
being some
That
people call it being
happens with me a lot.
yeah, some people call it being in a box. And the way to spring somebody from that box or spring yourself from that box is to not think of you as yourself or this body, and think of yourself as outside the body
Okay.
and be an observer of this body. and this is an overlap, but this is my technique as far as understanding cognitive behavioral therapy. So this basically says that you are just controlling this player. Number one, your chief goal is to make sure that this player survives and does well. Number two, it says that
Okay.
this player must treat other people well. And number three, this
Okay.
player must feel well at all times. So the way to feel well, you cannot always avoid difficult situations. That's number one. But you can avoid the emotional impact on the
Mm-hmm.
body of a difficult situation. Okay? So that's absolutely key.
Mm-hmm.
So by thinking of yourself as a video game player, you can move this person forward in doing the tasks. What happens to a person with ADHD is there's competing thoughts for this dopamine. And when one thought
Mm-hmm.
doesn't allow for that dopamine to be released for that person, then that task gets inhibited. Do you understand? So say there's an
Okay.
assignment you have to complete, that your body has to complete, that's due, or there's a job that you have to do to survive, right?
Mm-hmm.
The body, the mind will choose thoughts to stimulate itself over and over again to release that dopamine rather than getting that task done, which will end up in survival. So the way to deal with this immediately is to think of yourself as outside of the body and simply as a controller of this of the
Okay.
body, and you will end up stimulating your brain simply by doing that, because now your body has now come into a surreal area where you're just observing and you're pushing the body towards the direction that you want it to go in. And the moment that you find
Yeah.
out that you're not completing your tasks, that will be, and you'll have a frustrating situation. It will create frustration in you, because the key behind an ADHD person is that they have emotions, and those emotions are definitely there, and those emotions get that person caught up. Are you catching me? I want to just take a
Mm.
pause. Are you understanding what
Yes.
I'm saying?
Yes.
Is this
Yes.
clicking?
You're right. You're right. Yes, you're right. Because can I tell you, I often see myself in these situations when if there's an emotional turmoil or there's an emotional insult or I'm in an emotional situation, somebody had said something to me that hurt my feelings or hurt me in any way, I just keep on repeating those sentences, those scenes in my mind over and over again. I just cannot get my mind out of it. It takes huge amount of effort to take myself out of it. So I
Right.
really want to try what you're saying.
Right. So that's not fair to you, and it's not fair to the people around you, because the thing is that
Yes.
their thoughts may have moved around. But even me saying it's not fair, that can cause an emotional turmoil for a person with ADHD, because then that person is then automatically, that mind will go into, oh, am I being fair? Am I not being fair? Why did he say that? The tone, and people with ADHD can pick up on tonality. They can pick up on other things like unsaid intent. They're very perceptive and they're empathic. They almost can understand a secondary meaning behind what is actually said, just by listening to the cadence of what people are saying. Are you understanding? Like an example is, say
Yes. I
somebody
wish
says something. Yeah. Go ahead. Go ahead.
I wish everybody around me would think like that.
Yeah.
Yeah, you're right,
People,
doctor.
people
Please go
people
ahead.
with ADHD are incredibly perceptive people. They can pick up on these things, because everything that they pick up on is ultimately to stimulate those dopamine receptors. So they will pick up on everything, and they will analyze this thing because that is giving them some sort of stimulation inside. But it is so detrimental to life, and it's not helpful, because those thoughts are useless.
Mm.
So what ends up happening is that thought
Mm-hmm.
impedes the major thought of getting the job done. And
Mm.
throughout the day, you'll have like maybe 10, 15,000 thoughts on that topic, whereas you could have had two or three thoughts on the topic that moves you ahead, but that didn't bring you an immediate dopamine hit. So the brain didn't choose that thought. So the way to snap out of this immediately is to think of yourself as a player. and just you're watching, and that way your mind does not get involved in those thoughts. So as a player that's in a video game, you will attract or you will move towards areas that actually help immensely, that help your life immensely. An example is this, is say you're in a conversation that is feeling toxic. You will ultimately, you can get up and you can avoid that conversation. Your player doesn't have to react to that conversation, and you can just get the player out as quickly as possible by being respectful. If you are the body, then what happens is that that insult will play over and over in your mind. So that's one way to do it. Number two is it's very
So
easy to complete.
you
Go ahead. Go ahead.
you are saying I just walk away from the conversation? Will the
No,
other person won't
I'm
feel
saying is I'm saying
insulted?
you slip by the conversation is really what I mean. An example is say somebody's very
Okay.
confrontational, does all these things and is creating an emotional rise. You're noticing as a video game player, you're noticing the emotional rise within yourself. Like right now,
Mm,
I'm observing myself having a conversation with you. Say you start to get angry with me, I won't be worried about what my emotional level is, and I won't get caught up in your emotional level, whether you're happy or sad. I'll just be my neutral self because that is the because I know that my job is simply to help me get from this point by helping you, and that's my job at this point. Do you understand?
yeah. You are saying I can, when somebody's saying bad things to me, or
Well,
I'm
it's
feeling
not just saying
emotional.
bad things. Say they did a bad thing to you, say they did this. Obviously, you have your
Yeah.
job is
So
one
if
to protect. You have to protect you as the video game player, and number two, you have to protect other people. And so, and number three, you have to move forward in your life and the tasks that you've
so
been given. So you can look at it that way, or you can look at it in a different way. Like you are the mother of a child that needs to be taken care of. Okay. And that's basically it. And you are directing that child
okay,
to do different tasks.
okay.
That's it. End of story. So on a
Hmm.
deep, are you
I like
understanding?
this. Yeah, I've never heard this before. I think I like this technique. I've tried so many different things before, but really didn't help me much. Did help in the beginning, but then I just couldn't keep up with them. But I like this analogy. It makes me feel I think I can do this. I can try this.
Right. So that's the first thing. So the second thing that you need to do is consider a medication too. And the third thing is we need regular cognitive behavioral therapy. And we'll talk about that in different interviews with you as we go along. So this is my first interview, but
Okay.
it's absolutely necessary for you to get involved in this. And this is a deep meditation, actually. This meditation is actually there, and it can help many people in their lives to get past the perceived blocks that are in their head, because you're no longer this body. So it's a central tenet. Like it's the number one thing that's taught on a superficial level in meditation. So I really want you to
Mm,
understand this major concept is that this is actually a meditation. And this cognitive behavioral is a mindful meditation
okay.
of just
I know.
observing. So it's not a new concept, but it certainly is applicable to ADHD, and it's definitely something as far as bringing it to a video game concept. That's my concept, is saying that look, you observe yourself as a
Okay.
video game player through life. Now, if you are to protect this person, would you let this person jump off out of a window? No, you wouldn't, right? Because that's your number one job is to win the game. And the way you win the game is you protect this person, you protect the other people, and you complete the tasks that you need to get done. And that's it. And the way you do it is you just direct the body to complete that task. That's it. And there's no emotional attachment. You're just directing the body to complete that task. And that's it. And you're observing yourself while you do this. So this offers two things. Number
Hmm.
one is the actual observation of yourself doing a task is giving you that dopamine stimulation, because now there's two competing thoughts. The one is the doing the task,
Mhm.
and which is the main task, and then the second task is the noise that happens, and the noise is covered up by the observation. And the observation now is replacing all
Hmm.
the other emotional turmoil that you're using to actually do what you need to do, because your brain cannot hold so many streams of thoughts continuously at one time. It's usually one, two, or three streams of thought that your brain can continuously have at one time, right? So this allows you the thought that, yes,
Yes.
I do have an ADHD brain that type that I'm dealing with in my player. If I do have that, I will give this player one stream of thought, which is the observation, and then the other stream of thought is the action oriented. And when those two are going hand in hand, this is a very good cognitive behavioral technique to get stuff done. It's actually phenomenally effective.
Can you repeat that last part?
Okay. So imagine that the brain on a person with ADHD, I've said that it's got three streams of thought that are always happening. The first stream of thought that's happening with the patient with ADHD is the attempt to focus on a task. The second stream of thought that's happening with the
Mm-hmm.
person with ADHD is the interference that's happening that's trying to create that dopamine high.
Hmm.
Whether that
Okay.
interference is frustration, whether that interference is a past thought of a relationship, whether that interference is a future thought of what's going to happen in life, whether that interference is not is anger because you're caught up in a thought over and over again, that is giving a dopamine release that's there, that's overriding the first thought of the task. So now what you're doing is you're saying, no, I'm going to have two thoughts only in my life. The number one is the
Hmm.
task that's at hand. Number two is the observation of the tasks that I'm doing. And I'm going to be the observer of this person doing the task. And I'm going to watch this person doing these tasks, and I'll follow through with making sure that they get the task. That in and of itself is why people love video games, is because it's entertainment. And if you entertain your life by
Hmm.
observing what you're doing, it is quite an interesting thing, because then you become an observer, and the emotional level gets inhibited.
Hmm. Wow. Yeah, I like it. I actually like this idea. I'm gonna
Okay,
try it, doctor.
I try it. You can try it right now. Right now, as we're speaking, if you just think of yourself as an observer, you'll find that you're much more attuned than anything else if you just observe yourself doing it. So that's one way that people say that you should become an observer of your actions. Or, for example, our
Hmm.
parents, I don't know if your parents ever told you, um, just try to focus, right? What they mean,
Yeah, I hear that all the time. I've heard this all the time, all my life.
can you please focus? Can you please focus? What they're saying is, can your mind come to one singular form of thought and eliminate other thoughts at this point,
Mm-hmm.
right? That's what
Hmm.
they're asking. But a patient with ADHD will look at that, and that person who said, please focus, they'll say, okay, what was the tonality of that? How dare that person talk to me like that? Or, man, I really wish I could focus, or whatever. But those thoughts will actually inhibit the ability to focus. Instead, it's better for that ADHD, for the person who has that ADHD phenotype, to think of that body as simply a player and go from there. And if that body is simply a
Hmm.
player, and all of a sudden, things will start to come, and this life becomes more of a game, and it becomes much more fun, and you become much more alive, because now you're actively listening as if it's a game, trying to move up your player from one place to another. An example is sitting in lecture. It's
Okay.
much more easy if you're sitting in lecture, observing yourself and observing this body listening in lecture.
Hmm. So for the player, you're saying, if somebody is saying bad, if somebody is insulting me or saying bad things to me, I can just observe. I can just think that emotional turmoil is going to the player and not to me. It's happening with
Ah,
the player and not to me. Is that what you're
exactly,
saying?
exactly. And see
And
now
then
you,
I can control that player's action. Like I can control that player not to respond. Is that what you're saying?
what would you want the player to do to protect the player and to protect the people around the player? That's it. So say somebody's attacking the player, obviously you get the player out of there, or you do whatever it required in those situations, right? But say somebody is
Right.
saying something to the player, there's no need for the player to get involved in it. I mean, obviously, if I were the controller of my player, I would just move my player out so that it could go to more enjoyable position, or I would allow the player to engage to the point where the emotions of the player don't go haywire.
Hmm. Okay. Now I understand.
Right. So oftentimes you can then put the player in a position where you don't have to take everything to that level of emotional stimulation that it causes so many interfering thoughts with the actual tasks at hand.
Hmm. Okay. Got it.
All right. So I think this is great
Thank you,
for our first
doctor.
session.
Really helpful.
I think this is great
Yes,
enough for a
I
first
want to.
session. And then let's try this. And then let's also, on a different session, we can talk to the medications that we would do for you. And I'll make other videos, or my player will make other videos for this. Okay?
Okay, doctor. Thank you so much, doctor, for
Okay.
listening to me. I felt
Okay.
so light that somebody can really understand me.
Right. And so in your tasks, I just want to leave you with one thing. So now in your tasks, what day is it today in India? It's probably Sunday evening in India. And in America, it's Sunday morning. So if you have tasks that are taking place that need to take place, it's not very difficult to allow your player to just go through and do those tasks and observe them doing those tasks. It's okay. And then if the player gets fatigued,
Yeah.
you don't have to necessarily know that the player is getting fatigued at all times because the player can just keep going. So it's a very productive thing. So let me tell you on a different level, this is also, it's found in many faiths, it's found in many meditations that you are not the doer. You are a co-creator. If this goes to Oprah, for example, Oprah would say, you are a co-creator in this life. And the moment that you understand that you are a co-creator, that's something. Or if you go to Eckhart Tolle, Tolle will say, this is the power of now, to focus in on everything that's now. If you go to
Hmm.
Jay Shetty will say, think like a monk. Okay, if you go and these are all the same, they're all saying the same thing. All these power, these leaders, these thought leaders, they're all saying the same thing. And what they're saying is that somehow you have to cognitively get yourself from point A to point B. And the way that you do that can lead to a more successful, happy life. And that's it. And for people with ADHD, they love video games, most of them. And if you love video games, for a person with ADHD, it's better to just play the video game at all times. And this is the video game.
Yeah.
Okay.
Got it.
All right.
Thank you,
Take care.
doctor.
Thank you.